Hello, respected lecturers, professors, friends, and anyone else who may be watching this. In this 3-minute video, I'll be providing updates on the experimental treatment for type 1 and possibly type 2 diabetes known as beta islet cell transplantation. So first off, for reference, beta islet cell transplants are as their name describes them to be, where beta islet cells are dripped from a bag via a catheter into the hepatic portal vein, where the cells will remain in the portal vein and are responsive to glucose stimulation. According to Dr. Andrew M. Posselt of the University of California, San Francisco, about 50 to 60% of patients who receive this treatment reached insulin independence after 5 years. However, there are a lot of complications and setbacks to this treatment. First off, isolating the beta cells from a healthy pancreas is incredibly hard. In order to isolate them, the islet cells need to be purified to separate the insulin secreting beta cells from the glucagon secreting alpha cells and the delta cells. Insulin is the hormone that is responsible for reducing our blood sugar levels by allowing glucose to be stored in our cells as glycogen, while glucagon reconverts glycogen back into glucose. So in type 1 diabetes, the beta cells are no longer functional as your own immune system attacks them. So in this procedure, the cells of interest to treat type 1 diabetes are the beta cells. Additionally, the procedure for a beta islet cell transplant, despite being less invasive than a regular whole pancreas transplant, shares similar risks to it, such as bleeding, blood clots, and possibly side effects from immunosuppressive drugs in order to prevent the recipient's immune system from rejecting the transplanted islet cells during the procedure. And like most transplants, the drugs must still be taken post procedure to prevent the beta cells in the vein from being destroyed by the immune system, putting recipients at risk of infections from many external sources. Moreover, recipients may require 2 infusions in order to get enough islets that are working, or even 3, which results in shortages of beta cells. To solve the shortages, many researchers have been looking into stem cells as a source to generate beta cells, but that by itself is a whole nother complicated chapter in the development of beta cell transplants. If you're interested in the development of beta cell transplants, you'll be able to find out more and understand better by checking out this website, which even has an audio SoundCloud meeting with Dr. Andrew M. Posselt himself here. So to end it off, my personal comments and thoughts, I think that using an insulin injection is definitely a better choice, as this procedure is not yet fully developed enough to be used in place of whole pancreas transplants. The procedures are only allowed to be performed as clinical trials under the United States FDA and are even rarer in the UK. So that will be all for my 2 minutes and 50-second video. Thank you and goodbye.